Busy, busy, busy.
I have been experiencing some nipple tenderness.
I've started like cutting and stuff like that again.
And do you find the cutting's a bit of a release for you?
It does, but I mean, I used to work at the ambulance service, so I know it doesn't help.
You all right?
Yeah.
Oh, do you want paper towel as well?
My legs feel a little bit dead. It just feels weird when I walk.
Okay.
Thank you. I think we've had the 10 minutes now, more actually.
Don't worry. The 10 minutes is only a guide. It's more important about making sure that we manage you as a patient effectively.
If you feel pushing, that's fine, right? If it's sharp, then tell me. Can you feel any of that?
Hello, darling. Let me have a look at your hands.
Not good, no skin.
They're a lot better than they were, though.
No, the rest of my body, I've got no skin left.
I know it's you taking your skin off and regenerating it, but it looks a lot better.
I need some more.
You have to some more. Let me have a look.
But it did not enough for my whole body.
Give me your date of birth, sweetie.
23rd of the 10th, 55, spring chicken.
Juliet, yeah?
Can have a seat down there. How you doing?
Well, I cut my hand the other day. I'm really sorry if this is like a waste of time and everything, but
Okay.
I'm worried. Right, I was doing a washing up, had
Yeah.
my hand in a pipe class, went across, cut it, went to A&E. As I've been working and everything,
Yeah.
because I've had to still go to work, I think all the cuts open.
Yeah.
I don't know what I'm wrong with, but when I'm holding it, I can't really lift my fingers up, and I don't know if I've damaged something. It just got me
Okay, worried about it.
really worried because I need my hand
Yeah,
to
of
do my
course.
job.
You right-handed or left-handed?
Right-handed,
Okay. When was the actual injury?
Wednesday night.
Wednesday night last week.
Yes.
Okay, and so you went to A&E straight away after that?
We went to the walking centre, but yeah, A&E.
And you were saying that you were washing...
I was washing, I had my hands inside a pint glass and it
Yeah.
broke and I
And that's
twisted it.
when-
Yeah.
okay, fine.
If I try and force it up,
Okay.
it's really like I shouldn't be forcing
Just
it.
show me. Just show me what you mean.
So if I just do it,
Is that your wrist as well as the
no, I
fingers?
can hold the bottom
But you can't get the fingers up. Okay, let's have a look. Let's put your hand down.
because I've got to keep working everything.
You're...
I fix shutters and doors and drive stuff.
Can you feel me touching your fingers along there?
Yeah.
Same as the other side?
If it was a bit faint that side, but yeah, I can feel that.
Just squeeze my fingers for me. What's stopping you in here? Pain? You feel the stretch, or is it that you physically can't do it? Okay, you can relax again.
Ouch.
Push up against my finger.
No, I can't even, no.
No?
That one.
Athlete, cool. Hi, come in. Right, so what we're going to do today is we're going to start the vaccinations, OK? So today there's 3 injections and 1 medicine in the mouth. OK. So the one in the mouth is to protect the lining of the gut. OK, so because a lot of babies get diarrhoea and vomiting, they end up in hospital really dehydrated. A side effect, which I've never seen, but I'll just tell you about, is a problem with the guts, strangely enough, OK? The other 3 injections we're going to give in her legs. One of them is the meningitis B, and the research shows that it's quite likely she might develop a temperature with that one. Buy yourself some paracetamol, the brand name is Calpol, and that should be enough just to settle her temperature. So I'm going to draw up the vaccines, yeah? Oh, bless her. Are you feeding her yourself? Oh, wonderful. So that's what she's waiting for, isn't it? Oh.
So if I hold her, she's going to cry.
Of course she will. Of course she will.
You're scared of
I'm
them.
more scared of it than she.
Oh, bless you. I know, it's not milk, is it?
Okay. I heard you.
Right, hold still. All done. You all right? Yeah. Oh, do you want paper towel as well? There we go. Oh, you're still going? Oh, bless you.
She's all right.
OK, so make an appointment on the way out for 4 weeks' time, baby clinic. That's all right. You can stop crying now. We're finished. That's all right. See you again. Bye-bye.
Thank you.
All right, thank you.
Just need to put my baby's 4th week injection.
You just came in with that cute little baby. I hope you feel really horrible making her have an injection. Did she cry?
Loads. Yeah, even the mother cried.
Do you know what? I never used to take mine. I used to make my husband take them.
Yeah.
And do you know what? He found the best way to get the heat out of it? Get one of the small cans, put it in the fridge, and when it's had it done, just rub it on it. Just takes the heat out.
Okay. Thank you.
That is not looking that great, is it? It's looking a bit infected.
Does it?
But at least it's dry.
Okay.
And this one. Sorry.
It's all right, I just don't want to look at it in a second.
Looks quite deep, isn't it? So I want you to leave that there. I'm going to get one of the nurses to come up so they can sort out a dressing for us.
Okay.
And then I'll talk to you about what I think we should do about the actual thing itself. I'll be back in a second, right?
Thank you very much. Stupid problems to have.
He always gets up ear, very itchy, and my legs as well.
Basically, his ear keeps splitting open.
Okay.
I was given some steroid cream, and it seems to not be working anymore.
Oh.
It's so greasy.
One of the most common causes of itchy skin is dry skin. So the more you moisturise, the less itchy your skin will probably be.
Yeah, just slap it on, I don't care.
You're not getting any weeping or anything like that in your
Do you know what?
legs?
It's not even the cream you're putting on. Do you know what it is? It's the touch.
Use it once a day sparingly, the gel.
I don't think this is any rash to be worried about, OK? What I would advise is just make sure baby skin generally is well moisturised, OK?
No, hold that. It's your medicine.
It's like a mayonnaise bottle.
Yeah, don't want to put that on your chips.
Mr. Arif.
Thank you very much.
You're very welcome. Just take a seat. How can I help?
Now, these blisters come on. Here, here. And somebody told me that you can get it plaster from the surgery or something.
No, you would just use cream for those. You wouldn't use a plaster for those, yeah.
I punctured the bloody thing.
Oh, yeah, yes. I don't think that's such a good idea.
Isn't it?
No, you could introduce infection.
Oh, I see.
And then it could flare up. What do you puncture them with?
A sewing needle.
Sewing needle, yeah. No, because sewing needle would not be sterile.
Oh, no.
So it might be clean, but it wouldn't be sterile.
I usually put it under the hot water tap.
Well, that's good, or boiling water, but still not a good idea.
Right,
no, this is a form of inflammation of the skin called Pophylex. It's a type of eczema. Used you have eczema in the past? Is that something you've had for many years?
I had eczema in 2011, actually.
Was that the first time?
First time in my life.
You can get eczema at any stage. What brought it on, do you think, in 2011?
I have no idea, actually.
It just came. What I'm going to do is I'm going to give you a powerful steroid ointment. Now, ointment is rather sticky and gooey, so I apologise for that. But the reason I'm giving it is that the absorption of an ointment is much better.
All right.
So I want you to use those on all of the blistering areas.
Right. Thank you very much.
Good. You're welcome. Nice to see you.
Bye-bye, sir.
Bye now.
What's going around in my mind is whether this is to do with pain that's stopping you doing this, or whether it's deep enough that you might have cut something that needs more attention, right? And I'm not sure is the honest answer.
Okay.
So I'm going to have a chat with the on-call plastic surgeons about this, just to see whether they're willing to have a look at it today and see what they make of the function, right? Is that going to be okay for work-wise and stuff? You're looking a bit worried.
Fine.
I think it's...
Pain and it's pretty deep. I don't think it's a tendon.
Well, that's the reason why I'm going to ask them. And they're going to say one or two things to me. They're going to say, well, you know, maybe it's just inflammation, see how it goes. Well, then we get you to come back, and in which case I'll come down and I'll let you know either way, right?
Okay, brilliant.
Or they're going to say, well, if you're not sure, we'll have a look. Okay. And then they'll assess it. Okay, we've got a nurse downstairs who's just going to clean this up for us. So, do you want to come with me?
Yeah, brilliant. I've got a second, just got to get that out, so I look cool.
That's all right.
Hello, sweetheart. Where have you been?
I've been fishing around.
Have you?
Yes.
I do miss you when you don't come in, but I know that you're well, so that's okay.
Thank you.
Oh, hi there. My name's Mustafa. I'm one of the GPs from Farnham Road Surgery. Can I talk to you about a patient, please? A glass broke while he was doing the washing up, so he's got a laceration to his dominant hand, his right hand. I can't tell how deep it is, but it's quite granulated over the top. So I don't know whether he's done any sort of tendon damage underneath that or whether this is just because of the inflammation from the cuts. I was wondering whether you'd be able to have a look. How quick should that referral be? How urgent should I put it? OK, fine. That's perfect. Thank you. Cheers. Bye. Bye. So basically, I sort out the referral, which I'll do today, and we'll fax it off to them. In the next 2 weeks, if you haven't heard from Plastics, then about a clinic appointment with them, then I want you to let us know.
Okay, like you say, it's just all cut up, isn't it?
So then the thing with this is that if they review it and they say to you, you know what, we're really not worried about this, then the next thing will be to make sure that that stiffness doesn't remain as bad as it is now. So they might send you some physiotherapy. So there might still be an impact on your work for a little while to come. Maybe not as bad as having to take the whole time.
At least I'll be able to drive and do something.
Yeah, so we'll have to figure that out as we go along, depending on what they make of it. But that's your sick note, and it's from today for 2 weeks. Okay. I'd shake your hand, but I don't think I want to cause you any more pain. All right, take care.
No, seriously, thank you very much.
Take care. See ya. Bye.
It's Dr. Hyder. Come through and have a seat.
Thanks.
Are you Mum?
Yes, I am.
How can I help you today, Cohen? I know you've had some back pain, haven't you?
Yeah.
When did it all start?
The school phoned me to say that he had this severe pain in his back.
Okay.
And if I could drop some paracetamol down, but it just got too bad for him. He was crying in pain, and then he still got it. It's just kind of come out of nowhere.
Yeah.
It's just that he's cried with it, and that's not like him.
Yeah, yeah. So how did it start when you were at school? What were you doing at the time?
I now got on a coach. And that's when it started, but I don't know how.
Was that the school bus? Yeah. Okay. So in the morning. Yeah. And then was the pain bad at that point, or did it get worse later?
It got worse later on, and it just stayed like that.
Okay. And whereabouts in your back does it hurt?
It's around here.
The middle bit of your back.
Yeah, and then lower down up to like there.
All right. Any problems going to the toilet to wee or poo?
No.
Is that normal? Yeah. Okay. And any numbness or weakness or tingling, like a strange sensation in your legs at all?
My legs feel a little bit dead.
Which one?
Both of them, but they're just down here.
Okay. All right.
It's
And
a little
any?
bit hard to walk, but
Is it because you've got pain walking, or it feels numb when you're walking?
I don't really know. It just feels weird when I walk.
Now, would it be all right to examine your back? Yeah. Okay. Your mum can sit on there, and then you'll be with him as well.
You sure? Yeah. Okay.
Back pain can be a symptom of something quite serious in children. Most commonly, it's because of a muscular problem or a bone or joint problem in the spine, but more worryingly, it could be related to infection or even something as serious as a tumour. So I'm going to just test a few things with your arms and legs. Are you OK sitting for now? Yeah. Can you put your arms up like this? Stop me from pushing you down. OK, stop me from pushing them up. Put your arms like this. Push me away. Pull me towards you. That's fine. OK. Is it OK if I just get you to take your trousers off?
No.
I can.
Take your trainers off. She's going to need to. She might feel your feet as well.
Yes.
I'll get you to push your feet, so you need to take it all off. OK. He's ready.
OK. So if you can lie down for me on the bed, I'm going to just touch your legs to start with. Can you feel me touching you?
Yeah.
Is it about the same on both sides or different?
It's the same.
Now if I can get you to just sit with your legs hanging over the end. I'm just going to test the reflexes in your knees. If your child is experiencing back pain, the serious signs and symptoms to look out for are numbness, weakness and tingling of the arms or legs, and any bowel or bladder problems, so if they've lost sensation when they're going to the toilet.
Does there seem to be anything?
So from examining him, everything looks to be okay.
Yeah.
It's a bit unusual to have the pain and the numbness, though.
Yeah.
So I think for now, because the examination's normal, seeing how he goes over the next week or so with painkillers would be reasonable.
Yeah, okay.
And then I'll book him back in to see me and then re-examine again and see if things have got better.
Yeah, that's fine, no problem. Okay, thank you. Okay. Right.
Okay, so did you hear what I was saying to your mum? Things seem to be fine from examining you, but I'd like to speak to your mum next week just to see how you're getting on. Yeah, and if you know better, I'll get you back in and we'll take another look at you.
Good.
Okay.
Okay then.
All right,
Thanks very
take care
much.
then.
Thank you.
Bye-bye.
Bye-bye.
There we go, love. If anybody's got an appointment, you can use the self-check-in screen on your right-hand side.
If you've got an appointment, please use the self-check-in machine.
Has anybody else got appointments? Can you try and use the self-check-in?
If anyone has an appointment, please check in on the self-check-in.
Hi, Jin. Come in. Hi, I'm Dr. Sheikh. Have your seat, please. Right, how can I help you today?
I have been experiencing some nipple tenderness, and I'll be honest, about maybe a month, maybe 2 months, I had a little bit of discharge, and then it went away.
What colour was
it? It was sort of a creamy colour, and then it went slightly bloody.
Did it?
Yeah, but because it hadn't come back and it wasn't spontaneous,
Okay.
I sort of didn't worry about it. But the last, I'd say, probably week, my nipple has been quite tender.
Which one?
The left.
And was it the same nipple that you had the discharge
Yeah.
to? Okay.
And I had discharge this morning.
So creamy in the beginning.
Yeah, and then
with a little bit of blood.
And then it went
Was
slightly
it fresh
clear.
blood?
It was more like a bloody discharge. But I only stopped breastfeeding in January, so I wasn't sure whether it was connected or not.
Okay. Did you have pain at that time?
No.
No pain?
No, the pain's only been really in the last week.
Did you do any self-examination to feel for any lumps?
I've had a feel, but not. There's nothing that I have felt.
Okay. Any family history of any breast problems or breast cancer?
On my dad's side, there was breast cancer.
And
His
who had
sisters, his sister.
And how old was she?
I think she was in her late 40s.
Late 40s?
Yes.
Okay. We'll have to examine, yeah? So if you can take your T-shirt off and your bra off. So just tell me when you're ready.
Okay.
Yeah? Okay, ready?
Yeah.
Right, I'm going to examine your right breast first, okay? If you are in any pain, just let me know. So there's no been any discharge from the right? No. Show me your hand, just try and relax, yeah? Okay, and it's not tender as well?
It's a little bit tender,
but
yeah.
not much.
That's tender.
That's tender. If you can give me your hand again, just relax, yeah? I couldn't feel any obvious lumps. Okay. I can't feel any lumps under your armpits as well. Okay, get dressed and just, you can come and sit here when you're ready. Okay. Now, with these symptoms, were you thinking about anything?
I thought maybe it was an abscess in the milk ducts because of the breast, or, stopping the breastfeeding and stuff. And I also wondered if it's hormonal.
Sometimes when women breastfeed and they stop, sometimes they experience milky discharge. Yeah. But we do worry when it is blood with it.
Okay.
There are quite a few non-cancerous reasons, for the milky discharge, which you rightly said. But I would still suggest we refer you to the breast clinic. One, because of the family history, and second, because it is on one side.
Okay.
So what we normally would do is we refer under 2 weeks,
Okay.
which is a cancer referral.
Okay.
I can't feel any lumps,
Yeah.
so that is reassuring. But please come back because we need to explore the other reasons.
Can I come back and see you? Yeah. Okay. All right. Lovely. Okay. Thanks
All
very
right.
much.
Take care. Bye-bye.
That's lovely. Thank you.
Come and have a seat. How are you today, Jenny?
Not too bad. Problems with my left foot.
Okay.
I've been to A&E.
Yeah.
They reckon I've torn my tendons.
Oh, I see, okay. Now, this all happened in April after you tripped over your dog, is that right? Okay. Pop your shoe off for me.
It's the only shoes I can get on.
Is that tender?
Yeah, very tender there.
Any pain underneath the foot?
No, I just get a burning feeling.
All around the top there where I was pressing?
Yeah, oh, yeah, that's where all that bit.
Okay. Because you're getting ongoing pain with this, I'm going to refer you up to the orthopaedic surgeons for them to have a look at this. They may want to do further imaging to have a look and see what's going on. Does that make sense? Because for you to have pain ongoing since April...
It's ridiculous. It is getting ridiculous now.
We need to get
I'm struggling.
In the interim, I'm going to give you some pain, some good pain relief. Which pain relief do you want at the moment?
I've been taking everything. Everything I can get my hands on. No.
Cocodamol?
Yeah, I've been taking paracetamol, ibuprofen.
I'll give you some more cocodamol because that's an excellent painkiller. The thing with cocodamol is it can constipate you. That's one of the main side effects.
I suffer big time like that anyway.
When you took the cocodamol, did you have a lot of trouble with the constipation?
Yeah, sometimes I can go 2-3 weeks without going to...
Gosh, okay. What I'm going to do then, when I give you the cocodamol, I'm going to cover you with a laxative as well.
And also I'm going to put my hands up. I haven't been taking my insulin because I haven't had none.
Okay, so you've got 2 liquid films in the eye, one water and one oil,
Yeah.
right? What's happening here is you've got a little ball of fluid just underneath.
Yeah, it feels like
That's what
fluid,
you
yeah.
can So basically, that's a little bit red around this area on the right-hand side. After that, we clean up the area, and then I just slice it off at the base here. And that's it, really. If this doesn't work, then I want you to come back to us.
Spending more time here than we are at home.
Come and have a seat down there. So how is it?
It's alright. It's not so bad as it used to be.
Yeah.
I've just been cleaning it much more regular. Obviously today I've had a bath.
It's still
so
pretty bad, though,
yeah,
isn't
it's
it?
still bad. But...
Did we decide on taking out the whole nail or leaving a strip in the middle?
Yeah, taking a whole nail out.
Okay. And have you had local anaesthetics before?
Yeah.
Like you're going to the dentist, no problems with those? No. Okay. So the idea is, if we take this nail off and it grows out wide again, this whole situation might come back again.
Yeah.
Where it's all inflamed. So we put a chemical here called phenol, which effectively burns the bit where the nail grows on that side. So hopefully it will grow out not as wide, so it's less likely to cause you problems, yeah? And then take everything off, dress it. You've got to come back tomorrow for a dressing appointment.
Okay.
Is that going to be all right?
That's fine by me.
All right, so this is the consent form. There's your details there. All right, so it's a reasonably low-risk procedure, but there are risks, especially with the toe when it comes to infections.
I stubbed my toe like 2 days ago, and that hurt.
That must be horrendous.
So...
Yeah. It hasn't happened to me yet, but there is a chance that it doesn't grow back at all.
If it doesn't grow back, that'd be perfect.
Yeah, you prefer it.
it.
If you've got any questions, then fire away. Otherwise, if you're happy, sign and we'll get started. You can come and see me. I'll take distracting, screaming, swearing, whatever you like, as long as you keep the toe really still, okay? So first, scalp straps come in. You all right?
Mm-hmm.
This is a bit that you'll know if you can feel it. Okay, so just tell me, can you feel any of that? If you feel pushing, that's fine, right? If it's sharp, then tell me. Ingrown, isn't it?
And also, I'm going to put my hands up. I haven't been taking my insulin because I haven't had none. I'm diabetic as well.
Okay, Janet, that's massively important. Insulin.
I know it's massively important.
Yes.
And I had it on repeat prescription at the pharmacy down by me.
Yes.
Then they went for a stage where they can't get a hold of the one that I was on.
So you haven't had your Lantus since last September?
Yeah.
So it's been a year.
Me and doctors, I don't like coming down the doctors unless I really have to.
Okay. I'm going to give you a blood test form. I want you to get an urgent blood test done, okay? I want you to try and get it done today. Yeah. I'm going to book you into our diabetic clinic with one of our diabetic doctors because they need to have a look and see what's going on with your diabetic control. Does that make sense? The risk of uncontrolled diabetes, a heart attack, stroke, you know...
I've already had one heart attack and I've already had a mini stroke, which has affected my sight.
So that puts your risks even higher. So let's get this sorted. What I'm going to do is I'm going to squeeze you in with the diabetic doctor next Thursday. What I want you to do is I want you to record your sugars 4 times a day, okay? So before breakfast, before lunch, before dinner, and before bed. And bring those readings in when you see Dr. Nanda next week. He can then have a look at it and decide what insulin regime we should get you back on.
I will go, definitely.
Superstar.
Lovely, thank you very much.
No trouble, lovely to meet you, Jenny.
Thank you.
Bye-bye now.
This is just normal cream, okay? It's just to protect your skin on the other side while I do the chemical bit. So it's going to stay numb for a few hours, but you should be able to walk and still wait a bit because you can still use the ball of your foot, so that should be all right. All right, Julie's going to dress it for you. So the really important thing from today is that it stays completely dry once we've done the dressing, because if you get it wet, then the chances of it getting infected are much higher. You'll be able to use nail polish again in no time.
Yeah.
Okay, darling, there you go.
Thank you.
Good stuff.
Thank
Take
you very
care,
much.
okay? No problem. I hope it settles.
I'll see you now.
Take care. See ya. Block worked really well on that one.
This is Holly.
Yes, hi, I'm a medical student. Nice to meet you.
Right, here. Do you want to take a history?
Have you got a headache? Yeah.
The average consultation time in the UK is 12.5 minutes. And that means before you even start your surgery, you know that you're going to overrun.
Hayden Ford? In the GP training programme, we learn time management techniques and aim to deal with problems in 10 minutes.
Felicity!
Increasingly, we're having to deal with more complex medical problems that require far more than 10 minutes to really get down to the bottom of.
It's like we play darts on a Wednesday night.
Sorry to bring you back, because we're a bit short of time today.
I'm prepared to bend the 10-minute consultation rule when I have a patient in front of me that clearly needs more of my time. If we deal with 4 or 5 problems in 10 minutes, then it doesn't work. We don't want to miss anything. We want to make sure that we treat it effectively.
Of course,
Does that make sense?
of course. You've got a good going over today, believe me.
Bye. Take care. Gosh, the clock pressure's huge.
So that's about 30 minutes.
I know, that took me absolutely ages.
Yeah, but you went through everything, and you went through it very well and very methodically and logically. You do have to live with risk and uncertainty. But if you can say, do you know what, I feel comfortable, I'm not going to worry about that. If you're going out and going home worrying about a consultation, you maybe should have done this or that, it's often worth just giving the ring and getting it done or something. And you can't have that number of things playing in your mind.
No, Get mad.
We go back.
That'd be great. Yeah, that's fine.
Come on in.
Hi.
How are you getting on?
Yeah, good.
Perfect. Good. Let's talk about the rheumatologist. I know we didn't really mention that last time we caught up. You last saw the rheumatologist in August, didn't you? Actually, not too long ago. So how are things from that point of view?
Yeah, I would say it's mostly fine. I think my knees and feet do have the tendency to still swell occasionally. But I think apart from that, I think everything is still very firmly under wraps.
Good. Good. Okay. And just reading from the letter, I think the good thing is she didn't find any evidence of any what we call active inflammation in the joints, which is obviously the thing we worry about with arthritis because that can start to kind of damage the joints. So thankfully that's not the case. So long term, going forward, I don't think this should have any implications in terms of your mobility, in terms of the actual structure of your joints. I think really the priority will be to try and help you to manage your pain. Your rheumatologist felt that there were some elements of your condition that were more in keeping with a condition called fibromyalgia. I don't know if that was explained to you and sort of chronic pain. Holly was diagnosed with a condition called juvenile idiopathic arthritis, which is a type of arthritis that affects young people. About a year ago, she was also diagnosed with a condition called fibromyalgia, which is similar and can cause pain all over the body, mainly in the muscle groups. Were you referred to a psychologist?
Yeah, I started a pain management group Friday just gone.
You just recently? Brilliant, okay. Psychotherapy is no longer really a controversial method of treatment for chronic pain. A number of different types of therapy, including cognitive behavioural therapy, or CBT, are often used as well as meditation and even hypnotherapy. And really the main thrust of all of these treatments is to try and help change patients' perception of their pain and change the way in which it affects their day-to-day life. So it's not something, unfortunately, that will kind of go away magically with the things that we're giving you, but hopefully with the psychotherapy and the special sessions that you're going to be having, that will give you the kind of tools to manage it a bit better. And just a bit more about yourself. Are you working at the moment or no? Okay.
College.
You're at college. Fine. Okay. And how are things with that?
It's all going pretty well so far, yeah.
Yeah. Okay. Good. Good. Okay. So I think we carry on going as we are. Obviously, hopefully you get benefit from the sessions. If you need our help with anything, if you feel that things are kind of going back downhill again, you can always chat to us. Were there any sort of questions that you had or any concerns?
No, I think we're all good.
Good.
Awesome.
All right, take care.
Thank you very much.
All right, bye-bye.
Bye.
Hi there, Leanne. Come in. Right, what can we do for you today?
It's just a couple of quick things.
Yes.
First one to get over really quickly. These little skin tags.
Yes.
How can I get them off? Because I'm getting loads.
Let me see.
That one's the main one, the big one, which is it gets caught up in my neck and rubs on it, and I've got a few under my arm and that.
Okay. Because they're very small, you twist them and then you can sort of cut them off. Sometimes put a little bit of local anaesthetic in. It is a little minor operation.
Yeah.
But it would be very quick.
It's quick, yeah.
And what we do is sort of snip it off and then we cauterise the base just to stop it bleeding.
Yeah.
And that's pretty easy to do.
I want to do it, but I'm a bit wussy, so...
No, don't. Yeah, it's not a good idea because it will. You could do it, but it will just.
Yeah.
Be, right. Okay. So
that's the first thing.
Okay, I can do that for you.
The other thing I need at the moment, I'm going through trauma therapy a lot, and it's brought a lot of problems back up.
Yeah.
And at the moment, I'm getting not just anxious, but I'm getting very angry as well.
Okay.
And I'm struggling to control it.
Yeah.
And I was just wondering if there's anything that I can be given or get, or something to try and taper it down. I get also quite emotional, which isn't me. I don't cry for England, so just very...
And the therapy sort of sometimes is making that sort of come out, do you think?
It is, for me. Yeah, something happened in my past, and obviously now it's been all brought back up.
Okay. And sometimes that's what therapy does. And there are things we can do to try and help reduce some of the anxiety. It may not get the anger down, but if you make you less anxious and sometimes a little bit sort of more stable, then you can sort of cope with the therapy.
Because that's what's happened. I think I'm getting so high up, I've started like cutting and stuff like that again, which I haven't done for months and months and months.
And you don't want, you're not going to do anything more serious than that, are you? There is something not right with this.
Yeah, I'm having a problem with my printer.
Do you want me to just shut it off and then turn it back on?
Where did that go to?
I'm just fighting with my printer.
No, it's definitely not working, that.
I think I'm getting so high up, I've started like cutting and stuff like that again, which I haven't done for months and months and months.
And you don't want, you're not going to do anything more serious than that, are you?
I think you've always got those feelings there anyway. When you're depressed and everything's going on, that always there. So, but
You
no,
have them. Have you done anything about them?
No, other said than
The cutting? Yeah. And do you find the cutting's a bit of a release for you?
it does. But I mean, I used to work at the ambulance service, so I know it doesn't help, you know. But at the time, I think I'll get to that pinnacle where you're like, what do I do? And you know, as I said, that's when I do it. And yes, it helps, but then, of course, after you've got the guilt,
So it doesn't. It's a short-term relief, but and it's very difficult to sort of explain that sometimes to other people. But I can completely understand that. What I would say is that, you know, if there is anything else you can do just before that happens, like ring or talk to somebody, you may not be able to, then try and do that rather than cutting yourself. Obviously, you know, it's a difficult period, and what I'll do is I'll give you one of the antidepressants that is used to help with anxiety as well, to see if that then can help with it. Is that all right?
Thank you very much. Yeah, it'd be lovely.
There's definitely a stigma attached to self-harm, and people generally don't want to talk about it. But if we could break that, we can give people help. And we know that teaching people to deal with those crises of emotion can stop them doing things to harm themselves and sometimes stop them committing suicide.
Everybody thinks I'm quite like a bubbly person and talkative, and you just think you don't know the half of it behind the closed doors, isn't it? But I'm getting there.
It's a facade, and you've probably had years of practice of putting on a facade so people don't know.
Big face.
And a happy face, but underneath you're just sort of crumbling and you need a little bit of help. If things get really bad, one of the, I don't know if you've ever done it, but Samaritans are very good. And just ring that. They make no judgments. They give somebody to talk to. And sometimes just having that ability, and it's not somebody you know, and it's not somebody related to.
It's not family and not
takes
friends.
a lot of that away. And they're very good at doing that. I mean, it has helped a lot of people. And sometimes you just need something to stop you making that action. And it keeps you sort of stopped long enough for it to pass away. That's what you need. You need it to pass over, because otherwise you have to do something to get you through. And what you've learned is, if I cut, then it goes away, but it comes back, feel guilty, but it's and you need to unlearn that.
But it gets rid of that first.
It gets that first impulse.
Yeah, you sort of feel you're on the edge of a hill and you think, oh, I've got to do something.
Yeah. But if we can get, and once you can stop that, you know, then, but it's a difficult time for you, I can appreciate it.
And sometimes that's all it needs, isn't it? It's just that little bit of extra help. I hate asking for help, I'm one of the worst, but...
You know, if you'd broken your leg and I said, here's a crutch, you'd have said, fine. If your mind's not working as it should do, it's a little bit of help to get you through a difficult period. You come out and you then get on with your life again. And that's all it is. It's no different to that.
Very true. Hey, that is brilliant.
Okay, nice to meet you. Take care and see you again.
Okay.
Bye-bye.
Thank you. Cheers.
Come through, come and
Thank you.
How are you, Margaret?
Nice to meet you. Thank you for seeing me.
No trouble. How are you?
Well, not brilliant, but okay. I've come in because my nurse asked me to come and see you. I've written it down because I won't remember otherwise.
The not so good news under the circumstances is that in 10 days I've lost about 6 pounds, which is too much. I couldn't eat, and what I did eat, zoop. I really couldn't face it.
So you're having diarrhea?
Yes.
How long has the diarrhea been going on for?
10, 12 days. And I mean, I've never not been able to walk, you know, and that I literally didn't. I could stagger, but I just didn't. I mean, it's ridiculous.
May I have a feel of your tummy?
Yeah. This is funny enough, the tummy is behaving itself. You know, I haven't had lack of pain for a long time.
Okay. So I'm just going to gently press.
Having said I haven't got any pain when you touch, I have.
Is it sore when I'm pushing now? Or?
There. Yeah, there. Yeah.
Just have a listen to the tummy. Good. Jump back down for me. Margaret was diagnosed with a form of kidney cancer in 2009, and in 2015 it was discovered that she had a recurrence. She was currently enlisted in a trial under the specialists, and she is undergoing treatment for this. Now, there's a few things that we are going to do, Margaret. Because you've had 14 days of diarrhea, it absolutely could be a side effect of your medication. However, I just want to make sure that there's no other cause or other reason why you would be having the diarrhea.
Right.
So I'm going to ask you to send off 2 stool samples for me. When was the last time you had any blood tests?
Every 6 weeks.
Because you're getting the ongoing diarrhea, I'm going to request my own.
I think this is just a little glitch, and then we'll be off and running again, you know.
Absolutely. So here is what we are going to do. Okay, so that's your blood test form. So you book that in at your convenience. You can get that done here. These are the stool samples. Have you ever given a stool sample before, Margaret? Okay.
Thank you.
No worries.
I'm calm under fire.
It is important to make sure that we prioritise the most important ones. And, you know, the weight loss, ongoing diarrhea is definitely something that we need to get sorted. I want you to chase your oncology appointment to get a review with them, and I'm going to give you something to help you with the weight, OK? And come back in and see us, Margaret. If this isn't settling down, I definitely want you to come back.
Don't worry, I'll be here. Thank you. I think you've had the 10 minutes now, more actually.
Don't worry. The 10 minutes is only a guide. It's more important about making sure that we manage you as a patient effectively. Every individual is an individual. So add this to your blood test as well and get these things sorted. If it's not settling down, we definitely need to see you. Give us a call a week after you've done the stool samples to find out the
Okay, don't
results.
you worry, I won't mess around. I intend to make 10 years. At least.
Very good.
At least.
Good. I wish all my patients were like you.
Take care.
Love you too.
Thank you.
All right, darling. Bye now, Margaret.
Thank you so much.
No
Bye.
trouble. Bye-bye now.
Is that all right?
It's fantastic.
See you later.
Okay, bye, Ashley. Bye. Be careful driving.
Thank you very much.
Okay.
Thank you so much.
Oh, he is so sweet.
Bye.